Join me in Revision's surgery suite as I walk through a few of my surgical cases. By combining advanced technology with my skills as a fellowship-trained corneal specialist, I'm able to improve a patient's vision and quality of life. Helping people achieve their best vision is definitely rewarding and absolutely life-changing. So in this case, you will see a patient who elected for advanced vision solutions, but he had a unique scenario, maybe not unique, but less common, is there are certain patients that in the 90s, before LASIK existed and became popular, were very nearsighted and were looking for a surgical solution to improve their vision before LASIK was invented. The procedure is called RK, or radial keratotomy, and what that means is in radial spokes, there's a variety of incisions. It could be 4, it could be 8, it could be more than that, where from the center out, there's spoke-like incisions, 90% depth through the cornea, that had a flattening effect to correct varying degrees of nearsightedness for patients. It was very effective, but it was proven to be not as stable long-term as LASIK, and it also induced some irregular astigmatism, so the visual quality was not as good as LASIK. So LASIK took over RK for treatment of myopia or nearsightedness for those reasons. But there's still plenty of patients out there that had RK and now are looking for cataract surgery. It poses a unique challenge with cataract surgery because the RK incisions do affect our lens calculations. They also affect lens performance, and a lot of that performance can be degraded through irregular astigmatism and all these corneal incisions that they have. Therefore, our advanced offering with a new lens called Apthera is the best fit for their eye. It's typically placed in the non-dominant eye, so they will receive a more traditional monofocal lens in their dominant eye, and then the Apthera lens in the non-dominant eye. And what makes the Apthera work is, overall, it looks like a traditional one-piece lens, but it has a kind of circular black inlay that's embedded in the body of the lens. And it's very small. It's maybe 3.8, it's less than 4 millimeters in diameter, and then there's a 1.6 millimeter opening. It's almost circular, like a washer that you would find in your toolbox, but much thinner and much more microscopic. And what that does is the body of that ring blocks out a lot of light. So the patient's just looking through that 1.6 millimeter central opening. That essentially creates a pinhole. And pinhole optics, we know from our experience, eliminates a lot of blur and can eliminate irregular astigmatism that comes from all of these corneal incisions that RK patients have. So this lens is really effective in giving an increased depth of focus for patients and the highest quality vision that they can possibly receive with any technology. Viewer discretion is advised. This video shows live footage from an actual surgical procedure. This is a patient who has had femtosecond laser-assisted cataract surgery. So that portion is done and the cataract has been removed. Now I'm enlarging an incision because he's getting a new technology lens called Apthera. This is a lens that looks like a normal intraocular lens, single piece, but it has a black ring in the middle that you'll notice once it unfolds. And the purpose of this ring is twofold. One, through small aperture optics or pinhole optics, this ring allows the patient to see at an increased depth of focus. Also, with that small central opening in pinhole optics, it is able to reduce irregular or regular astigmatism through the small aperture optics, so their vision will be better and it can correct irregularities which most lenses, including astigmatism correcting lenses, cannot correct. The reason that this patient has irregular astigmatism is because they have had a procedure that was around for a short period in the 90s called radial keratotomy, or RK. And if you look at the cornea, you can see some lines in the cornea. They're kind of opaque white lines. Those are old RK incisions. Although that was effective at reducing nearsightedness or myopia, it was only around for a short period of time because LASIK came out shortly thereafter. And LASIK was much more stable and predictable and did not induce irregular astigmatism. So this patient's irregular astigmatism and nearsightedness was corrected with this Apthera lens, and really helps him see his best, and he's going to see better with this lens than with any other lens technology that's out there. And I centered that black ring on the light reflex, followed by the usual steroid and antibiotic injection of Trimoxy at the end of the case.